Hello dear friends, welcome to PharmaGrid. So let's begin with today's KAPS recalls discussion. Question number 41. Chemically, ibuprofen is a derivative of. The options are fibric acid, phenylacetic acid, propionic acid, salicylic acid. Here the correct answer is option C, that is propionic acid. That is ibuprofen is a propionic acid derivative. Here you can see the structure of ibuprofen. It is 2-para-isobutyl-phenyl propionic acid. It is a non-steroidal anti-inflammatory drug. Next question. Which one of the following tricyclic antidepressants has been used successfully in treating nocturnal enuresis in children? The options are amitriptyline, doxepin, imipramine, nortriptyline. Here the correct answer is option C, that is imipramine. Imipramine in doses of 25 mg 1 hour before bedtime reduces the incidence of childhood enuresis. Enuresis means bedwetting. If unsuccessful, the dose may be increased up to 75 mg. Next question. A lab test that aids in the diagnosis of cancer of the prostate is. The options are PSA, GGT, ABG, SGOT. Here the correct answer is option A, that is PSA. PSA refers to the prostate specific antigen, which as a glycoprotein product is almost exclusively produced by prostate epithelial cells. Routine determination of PSA allows comparison of newer values to the individual's baseline value. So increase in value indicate the possibility of prostate cancer. Question number 44. Which of the following would be suitable to use in a patient who needs a cardiac glycoside but has severe renal impairment? The options are amiodarone, disopyramide, digoxin, digitoxin. So among these options only digoxin and digitoxin are cardiac glycoside. So here the correct answer is option D, that is digitoxin. Digitoxin is a cardiac glycoside suitable for use in patients with renal impairment because it is primarily cleared by the liver. Digoxin is cleared primarily by the kidneys, so it is not safe in patients with a renal impairment. Next question. Mixing a hypertonic solution with red blood cells may cause dash of the red blood cells. The options are bursting, chelating, crenation, hemolysis. Here the correct answer is option C, that is crenation. A hypertonic solution will draw water from within the cell until an equilibrium is reached with equal pressure on each side of the cell membrane. Because of the loss of volume, the cell will shrink and take on a wrinkled appearance. This condition is known as crenation. So solutions that have a higher osmotic pressure means hypertonic solution, will cause water to pass out of the red blood cells. So as a result of this, red blood cells will shrink. Suppose if a cell is placed in a hypotonic solution, hypotonic means there will be low concentration of the solids. What will happen to the cell? The cell will take more water and it will swell. Okay, so this is the condition in case of hypertonic as well as hypotonic solution. Okay, so with this question we have completed today's recall session. Thank you for watching this video. If you like the contents of this video, please subscribe and share to your friends.